Today, we're going to talk about another very common orthopedic injury called the colles fracture. It's also an injury from fouche, or falling onto your outstretched hand. It happens often in older patients, especially if they're osteoporotic or have low bone density. They fall on a standing height onto their wrist, and the bone breaks. On exam, it often looks like a dinner fork, so it's also called the dinner fork deformity or fracture. On imaging, you'll see that there's shortening around the radius. It becomes short, and it's tilted back dorsally, just like a dinner fork. Most of these will require reduction, ideally as fast as possible, and reduction just means we put you in the splint and keep it immobilized. It'll be much more emergent if there's bone poking out, or if we do an exam and you can't feel anything on your fingers, or your hands are cold, there's problems with the vasculature, such as the radial artery getting compromised. You will usually stay in the splint for about 8 to 12 weeks and be followed up in about 2 to 3 days after you're placed in the splint. If you're over 50 years old, we'll make sure to work you up for osteoporosis and make sure you have enough calcium and vitamin D, and possibly start you on medication if you're at risk of osteoporosis.